In this video, you'll learn major anatomical terminology used to describe the body, including a coordinate system of direction, terms used for surface landmarks, and terminology for sectional planes of the body. This illustration shows us the directional coordinate terms that are used to describe the relative position of structures in the body. This directional coordinate system is similar to the coordinate system that you're familiar with for describing the location on our planet, like north, south, east, and west. For the body, we must learn this directional coordinate in the anatomical position shown here, although the relative position of structures can move, their position in the relative coordinate system won't change. For example, if a person is laying down, superior will still lean towards the head and inferior will still lean towards the feet. Although while they're standing up, superior is up and inferior is down. These are relative terms. So medial means towards the midline, but it's not an absolute. It doesn't have to be right at the midline where the belly button or umbilicus is. Lateral is the opposite, meaning away from the midline, towards the right or towards the left. For example, the mammary region, where the breast is located, is lateral relative to the sternum, but it's medial relative to the upper limb. Anterior and posterior are opposites. Anterior means towards the front and posterior is towards the back. Ventral is essentially a synonym for anterior, and dorsal is essentially a synonym for posterior. Proximal means closer to a point of attachment along one of the limbs, and distal means further from a point of attachment along one of the limbs. You can see cranial and caudal are similar to superior and inferior, cranial meaning towards the head and inferior meaning towards the tail or down towards the coccyx, the tailbone in human. There are specific terms for regions of the body. Many of these come from Latin or Greek. Cephalic refers to the head, while cranial is the region of the skull surrounding the brain. Oral is the mouth. Mental is the chin. Frontal is the forehead. Nasal, the nose. The eyes are called the ocular regions, whereas otic refers to the ear region. Buccal is the cheek, so the lateral aspect of the oral region is the buccal region. The neck is the cervical region. You'll learn about the cervical vertebrae, the 7 bones in the neck. Then there is a thoracic region, the chest, and the spine has 12 thoracic vertebrae. The breast is known as the mammary region. Sometimes the literal historical meanings of a word is different than the technical anatomical meaning, but these bits of information can add interest and help to form a context that anchors this new information in your vocabulary. For example, the word abdominal means belly, but it comes from the word abdere, which means to hide, as a reference to the fact that the organs are hidden within the abdominal cavity. Umbilical is the navel region, the belly button. Pelvic refers to the hip, comes from the word for basin. The pelvic bone has a basin-like shape. It holds the urinary bladder and the reproductive organs within the pelvic cavity. Inguinal refers to the groin, the lateral region of the groin, or the most inferior and lateral portions of the abdominal pelvic cavity, also known as the iliac regions. Pubic is the groin region, the medial groin region. So where the external genitalia are located is the pubic region. And there's a bone called the pubic bone. The axillary region is commonly called the armpit, whereas the brachial region is the upper portion of the arm. Antecubital refers to the anterior side of the elbow joint, whereas antebrachial refers to the forearm. Carpal is the wrist, and learn the names of the 8 carpal bones that are found there. Palmar refers to the anterior portion of the hand, the palm. Digital refers to the fingers or the toes. And phalangeal also refers to the fingers or toes, and the bones found within those regions are called the phalanges. The pallidal region, or the pollex, is the thumb. Femoral refers to the thigh, and patellar refers to the knee. The patella is the bone found on the anterior of the knee joint, and the word patella comes from the Latin word for a little plate. Fore refers to the leg, so the lower leg, the portion inferior to the knee. Tarsal is the ankle, and you'll learn the names of the tarsal bones found there. The halluceal region, or hallux, is the largest toe, the most medial of the toe. And pedal refers to the feet. Acromial refers to the shoulder region. It comes from the Greek word akron, which means tip or summit. The word dorsal means back. Olecramal is the dorsal side of the elbow joint. Lumbar refers to the lower back, as well as to the lateral regions of the abdomen, inferior to the hypochondriac and superior to the iliac region. Gluteal refers to the buttocks. Popliteal is the posterior side of the knee joint. Sural is the calf. Calcaneal is the heel region. Plantar is the inferior surface of the foot. And now that you have the basic anatomical landmarks, you could use them together with the directional coordinate term to describe the relative positions of structures. For example, we can say that the popliteal region is proximal and superior to the sural region, or the acromial region is lateral to the cervical region and proximal to the olecramal region. To study the internal structure of the body, it is cut along standard sectional plane. The sagittal plane is a vertical plane that divides the body into right and left portions. Any vertical plane that slices through the long way of the body is a longitudinal plane. So the sagittal plane is one of the longitudinal planes. A mid-sagittal section goes right down the midline, producing equal left and right half. A parasagittal section is a sagittal section that's not right on the midline. So one side is larger and the other small. A frontal plane, also known as coronal plane, is also a longitudinal plane. However, the frontal plane divides the body into anterior and posterior portions. In contrast to these longitudinal planes, the transverse plane is horizontal, dividing the body into superior and inferior portions. If a section through the body is cut at an angle that's not transverse, coronal, or sagittal, but is at another angle, we say that's an oblique section.